known as WASH, by the Quality Council of India to ensure safe operations and workplace for safeguarding health and safety of employees, customers, and public. The certification ensures compliance with all new COVID-19 related requirements from regulatory and health authorities. So joining us today is Dr. Jaydeep Walinjkar, a senior consultant and a vitreoretina specialist at Aditya Jyot Eye Hospital. Currently a renowned retina surgeon in Mumbai, Dr. Jaydeep has also been a research and clinical fellow in vitreoretina from the prestigious Shankara Nethralaya in Chennai. Host of vitreoretinal diseases and has performed over 2,000 complex surgeries independently. Dr. Jaydeep has also been a forerunner in treating patients at Aditya Jyot Eye Hospital throughout the COVID-19 pandemic. And in fact, today he's giving us this interview from the hospital itself post a busy day. So today's topic is about age-related macular degeneration, which is the third leading cause of visual impairment and is a condition that has very little awareness and so comes as a shocker to most when it's detected. Late age-related macular degeneration, or also known as AMD, is the most common cause of blindness and vision loss in higher usually found in higher percentages in people above the age of 70. AMD, its prevention and treatment often come with a lot of questions and fears in the mind of patients. Eliminating the fears that a lot of patients have for themselves or their loved ones. Thank you so much, Dr. Jaydeep, for joining us today and giving us your time and willingness, even though you've had a very busy day and schedule. Over to you.
Thank you, Ishita, for the kind introduction, and thank you, Dr. Natarajan and Dr. Radhika, for giving me the opportunity to talk on this very important topic for the public today. So, good evening, everyone, and I'll just start off with my talk, and I'd like to keep it really brief. And after that, maybe we can have a good discussion and a good question answer session, which everyone would like to know. So, as Ishita said, today we're going to talk about age-related macular degeneration and what should we know about it. So, let me start my talk. I hope my slides are seen.
Yes, sir.
Yeah. So let me just give a very brief view of the internal structures of the eye. As we all know, the eye is like a globe, and it has basically it's divided into two compartments. One is in the front portion, what we see, or the anterior portion of the eye, called the anterior segment, and a back portion of the eye, which we cannot see unless we use special techniques. That is called the back portion of the eye, or the posterior segment. So here we are going to talk about this back portion of the eye and this condition, that is age-related macular degeneration, which affects the very central part of this back portion, or the retina. And this small tiny dot here is an area called the macula, which is the most important and sensitive part of the retina, and this is where this degeneration occurs. So, as I said, the retina is like a thin film of wallpaper which is stuck to the internal parts of the eye, and it is a light sensitive layer. So the light falls on this layer, and the light energy is converted into electrical energy, and through the nerve of the eye it is transmitted to the brain, and that is where we actually have vision. So this degeneration or this disorder affects the central retina or the macula, and the fovea is the very center of this circular area called the macula. So coming to age-related macular degeneration or AMD, how does it affect our eyes? So as I said already that it affects the central part of the retina or the macula, which is very important for us for our day-to-day activities. And basically it is the most important part for reading, writing, fine vision, color vision, ability to recognize faces, to drive, and so many important tasks of our daily life. So how does it occur? Basically, there is an abnormal growth of blood vessels under this small area of the retina, and that starts leaking either fluid or blood, and that causes the damage. And this particular growth of blood vessels is stimulated by a chemical called VEGF. So we'll discuss about that later. So I would like to show you how a normal retina looks in the back portion of the eye, central portion of the eye. This is the one image to the left. This is how a normal eye looks, or the normal retina looks. And this is the one which is the one with AMD. As you can see in the center, there is a large grayish yellow structure with dark borders, and you can see the normal structure is completely destroyed. So this is how an advanced case of AMD would look like. So what can be the symptoms and signs of this disease? So if you ever come across suddenly noticing blurred central vision, and if you start missing out letters while you're reading and objects start appearing distorted, especially straight lines or letters appear distorted, or if you have a kind of a patch in your vision, in the field of your vision, then you should consider this could be a symptom or a sign of age-related macular degeneration. And most important aspect is it is a painless condition, so you will never have any pain associated with it to, you know, make you think that it's an emergency. So you need to keep an eye on this. So what happens is you start missing out on some daily activities, like you may find it difficult to read, to drive, to do cooking. You might feel that you need a little brighter light when you're reading, and you can't read when in dim lights, dim illumination, and you might feel there is some distortion in the letters or difficulty in recognizing faces. So these are the symptoms which you should be aware of. Now, AMD, as we know, is divided into two broad types, and one which is benign and one which is not does not progress fast is called a dry type of AMD. So this occurs about 80 to 90% of the times in our eyes in patients with AMD, whereas the wet type is about 10 to 20% only. However, the dry type has a more benign course and doesn't cause advanced vision loss until its advanced stages. Whereas this wet type of AMD always occurs suddenly, and your vision drops suddenly, and you may have profound loss of vision if you don't treat it. So this is the one which needs to be treated on an urgent basis. What are the risk factors for AMD? So as we know, it is already in the name, age related. So it's primarily a disease of the old age. So age itself is a risk factor for getting this condition. The other factors could be smoking, a family history of AMD, heart disease, hypertension, obesity, and there is a slight gender predisposition because women are more affected with this compared to men. So how do we diagnose this condition? As we all know, if you, as I told you, if you see any of these symptoms, you can go to your local eye doctor and they may refer you to a retina specialist. And once we have checked the retina, there are certain things or investigations which we need to do. The basic things which we always check are the vision and the dilated fundus examination or the retinal checkup. Once we do that, we have a fair idea about what is the condition. So one very basic home test which you can do at home is called the Amsler grid test. Now this is nothing but a white sheet of paper with black grids on it, and there is a dot in the center where you need to focus with one eye closed, wearing your glasses. And while you're focusing at this dot, you need to see if you see all the lines straight, or they are distorted, or do you find any kind of spot which is blocking the lines anywhere, or the corners of the square anywhere. So that is a very good test to do at home, and we also do it when you come to our clinic. The next would be investigations, and the most basic investigations for these conditions are two. One is called OCT, or optical coherence tomography, and the other one is called a fluorescein angiography, or a FA. Now, I wouldn't go into the details of these tests, but they are some things which are primarily focused at knowing the extent of the condition and whether it's active or inactive, and also useful for monitoring the treatment. Coming to the treatment or management, the goals of the treatments are basically to stop or slow the disease progression, to preserve, improve, or restore the vision. And while doing this, early management is always crucial, because in case of delay, the conditions are such that the damage is not reversible. So picking them up early is very important. So treatment in the form of non-pharmacological therapy, or something which could be related to lifestyle modification, is regular exercise, avoid smoking, eating nutritious food, avoiding obesity, and having a regular eye and retina checkup. When it comes to treatment with pharmacological agents or any kind of drugs, then we have various options. So one of them is for the dry age-related macular degeneration, and here we give a combination of multivitamins and antioxidants, which are in precise dosage, and it has shown to delay the progression of the dry type of AMD by about 50%. For the wet type of AMD, now we have treatments in the form of some injections in the eye, and they are called anti-VEGF therapies. So these are nothing but, as I said in the beginning, there is a chemical which is released in the eye and that propagates this disease. So these drugs which are injected inside the eye help to negate or to neutralize these chemicals. So this is the most recent form of therapy and has promising results. There are certain lasers which have been used in the past and are still being used, like photodynamic therapy and direct laser treatment, but they are seldomly used in current practice unless specifically indicated. And lastly, the surgery part, I think today we have given up doing surgeries for this particular condition because the results are not very good, and so surgery is seldom done. Now, after all this, and once the disease has regressed after the treatment, then comes a point where there is still some irreversible vision loss which is still present. And to overcome this, we have something called low vision aids, or some special kind of devices or glasses which help us to see better. So these patients may be benefited, and each patient has to be customized to the particular low vision aids which might benefit him or her. And that is something which again is a very fast changing or ever increasing into our armamentarium for treatment. So low vision aids play a very important role in visual rehabilitation post treatment. And of course, we need to have lifestyle modifications for long term benefits of all the treatment, as well as these conditions could happen in the other eye as well. So we need to stop smoking, have a healthy balanced diet, drive safely, use proper displays on computers, avoid ultraviolet light from entering the eye excessively, because all these can propagate this disease, and use little higher illumination at home. Sometimes you need to use low vision aids like magnifiers, and electronic devices, of course, nowadays have so many options for people with low vision, where they can be able to read or type or write using these devices. So all these lifestyle modifications, along with the treatment and special use of low vision aids, can bring all these patients to their normal routine life, and you know make them fit into our society without feeling that there is any problem with their vision. So with that, I will stop, and over to you, Ishita.
Thank you so much, Dr. Jaydeep. That was so informative. It was crisp, and it was very easily understandable. And on that note, I have a list of questions that I would like to ask you that some of our patients have also sent. And I would like it if if you can elaborate on these common questions. A lot of them are common fears. That would probably help people listening to us and also our patients eliminate a lot of doubts around age-related macular degeneration.
Right, right.
Okay.
I'll be happy.
Okay, just give me a moment. I'm just going to read it out from my phone.
Sure.
And uh, just, okay, sorry for the delay. I think it's the technical aspects related with COVID sometimes do take over. So the first question here is age-related macular degeneration the same as macular degeneration?
Well, see, the term age-related macular degeneration is specific for a type of macular degeneration which appears in the older age group and which is not associated with other genetic disorders or other ocular conditions. So, macular degeneration can be due to multiple diseases like inherited retinal diseases, or like high myopia. High people with high minus power may also have macular degeneration. So, various types of macular degenerations are there, but this particular macular degeneration is related to aging, so that is why it is called age-related macular degeneration.
Right. Okay. All right. So the next question here is, can you get AMD in only one eye, or does it always occur in both eyes?
Yeah, so this is important because we normally have patients who present to us with this condition in one eye, where it is symptomatic, or rather where they need treatment. But maybe almost 50% of times we will find this condition in the other eye as well, but it is subclinical where they don't have any symptoms. Secondly, there are patients who come with to us for treatment when the other eye is absolutely fine, but we have seen, if you follow them up, maybe after 4 years, 5 years, or maybe even longer than that, the other eye has a very good chance of getting affected. So you cannot say that it is a bilateral disease to start with, but it always affects the other eye. I think almost 80 to 90% of the patients will have the other eye affected eventually. So that is why we need to keep checking both the eyes, and we should take appropriate precautions and treatment.
Oh, wow. Okay. All right. So the next question here is, so patient has asked, I heard AMD can happen to people who are younger as well. Is this true?
Uh, we do have patients who present to us with macular degeneration in the younger group. As I said, there are there is macular degeneration of various types. There are certain inherited disorders of the retina where even children have macular degeneration, but it is different from AMD. So AMD has a very high prevalence above the age of 70, 75, but in the middle ages between 50 to that around 70, that age also has a predisposition for getting this condition. So you can say relatively younger people compared to the really geriatric age group are also at risk. So anytime after 50, I think this condition is, you can get it. It is possible to get it. I think
Yeah, sorry. So the next one is, will using my damaged eye after I've been diagnosed with AMD contribute in progression of AMD in that particular eye?
no, that's a very big misnomer, because I think it's a misconception rather, sorry, because using your eye is not going to cause any damage or further damage the eye. The only thing is that can happen is if you're using your eye with the macular degeneration, you will find it difficult to read, so you will try to strain. And once you strain, your eye does get fatigued faster. And associated with fatigue, you may get some symptoms. But you will never damage your eye while trying to use it, while you have this condition. So you can easily do all normal activities with your eyes, even if you get this degeneration.
All right. Thank you so much. So, sir, we have a question from someone watching us right now. Mr. Abhishek Jain is asking, I lost 75% vision and cannot read. This also leads to headaches. What can I do?
Okay, so headaches, I don't think can be directly correlated to the decrease in vision, but yes, over after you have, as you said, lost 75% of your vision. After that, you tend to strain a lot to do any kind of visual activity. So once you strain, that causes eye strain, and that is ultimately leading to a headache. So what you need to do is find out first what is the cause of this vision loss, and then try to find appropriate, you know, palliative care for it, or rather, what I suggested, low vision aids. If you can try to find out what suits you, you can read better and reduce both your headache as well as improve your vision.
All right. Thank you so much, Mr. Jain. I hope that answered your question. So the next question here is, will resting or not using my good eye much help me preventing development of macular degeneration in that good eye?
Okay, so as I said earlier, using your eyes are never going to cause any damage to your eyes. So eyes are meant for doing what we do with our eyes. So there's no condition where you need to stop seeing. So using your good eye is definitely not going to increase the chances of getting this disease, or even if you get it, it is not going to increase the progression of this disease. So you definitely can use it, and there is no risk involved related to your visual tasks or visual activities, which is going to cause increase in this condition. So you don't have to worry about it at all.
All right. So, the next question here, I think you've answered it already, but, it would be nice if you could, once again mention it. Is macular degeneration painful? But I think you mentioned it's not painful. Could you elaborate a little bit on that?
Yeah, so macular degeneration is a painless condition of the eye, to be more precise, of the retina. So we don't have any pain, receptors on the retina. So I don't think it causes any pain. So you will not have absolutely any pain when you get this condition. So you just need to be vigilant with your visual symptoms, and need to keep checking with your eye doctor or retina specialist to pick up this condition early.
All right. So the next question, or rather fear, if I should put it that way, is can this condition cause total blindness?
Right. So to answer this question, total blindness, I would first like to differentiate between total blindness and what we call legal blindness. So total blindness is absence of seeing any light. Okay. So there are very few conditions which lead to that. So age-related macular degeneration doesn't cause total blindness. What it causes is a central vision loss. The peripheral retina is still fine, so the peripheral vision is not affected. So a lot of patients who have this condition and they have lost their central vision, they can still manage to navigate and do a lot of daily tasks with their peripheral vision, and it never leads to total blindness. But when it comes to talking about legal blindness, that is something which is important from the aspect of doing activities like driving or operating some machinery which require good vision. Those things are affected, and patients with advanced condition do get legally blind, but that is not total blindness. So that's a good thing about this condition. So if you train yourself appropriately, your peripheral vision can be used for a lot of your daily activities without any problem lifelong.
Thank you so much for sharing that. Okay, so the next question is I like reading a lot. Is my macular degeneration going to advance rapidly if I continue reading the way I do?
Right. So I think I already addressed
Yes, you
this
did.
question, but I don't think your macular degeneration is going to progress if you read. You can
Right,
read as much as you want. There is no problem as long as it doesn't, cause you any discomfort.
right.
So you can read without any, headache, eye strain, or any problems. You please continue doing so. There is no restriction.
Right. Okay. So the next question is, does AMD come in stages, or if you could share a little bit on that?
Right. So yeah, very, very correct, important question here, because AMD, as most of the diseases, does have stages. So it is divided broadly into early stage, intermediate stage, and late stage. So both the dry and wet types of the AMD have these stages. And in the early stages, the patient might just have visual symptoms like some distortion or some bending of some letters, and otherwise they can read everything or see everything. Subsequently, as the disease progresses in the intermediate stage, the symptoms become more severe, and there might be a central vision defect, and patient might have has inability to recognize faces and difficulty in reading in dim illumination. And in the advanced stages, there will be a total central black spot which will block the whole central view. So these are the stages and the symptoms associated with it. And in the only difference is in the dry type of degeneration, it progresses very slowly over a period of many years and may not even affect the central vision throughout the life of the patient. Whereas the wet type of age-related macular degeneration, it affects the central vision very fast and early, and there could be a sudden drop in vision, and also has a relatively poor prognosis when it comes to its treatment and long-term vision, gain or long-term vision of the patient. So that these two broad differences need to be kept in mind. And if in case of symptoms, appropriate symptoms, the patient should definitely contact the retina specialist immediately.
All right. Um, okay, so we have an other live question from Mr. Manoj Motrane. And he is asking, are these eye vitamins really helpful? And does it help if we have already existing eye problems?
Okay, so the eye vitamins which I was talking about are very specific for the dry type of AMD. So they have been, you know, kind of researched and evaluated in the dry type of AMD, and the formulations have been, you know, the quantity and the dosage have been studied, and when given in the correct combination and the right sequence, they will help to retard the progression of the dry type of AMD by almost 50% when it is in the early and intermediate stages. So that is what the studies or the global trials with dry AMD tell us. So for other eye conditions, there is no proven benefit of these vitamins. So you cannot just take them for any condition. So if doctor has prescribed you, it means you probably have dry type of AMD, and in that particular condition, it is definitely useful to retard the progression of the disease. But in advanced cases, it is not going to work. So that is something you need to keep in mind.
Right. Okay. All right. So, on those lines, the question here is, can you reverse macular degeneration?
Yeah, right. So the macular degeneration in the early stages, especially the dry type of macular degeneration, can reverse in some of the patients, whereas the wet type of macular degeneration does not reverse, but when treated appropriately and early, can be arrested, and the long-term side effects, complications related to this AMD can be minimized. So we cannot reverse the wet type of degeneration completely. There is some residual damage which occurs, but if you treat it early enough, you can have even near normal vision. Whereas, and in dry type, it can be reversed in the early stages. So if you take the proper precautions and the supplements, it can be reversed. Of course, once it starts causing some kind of permanent damage like retinal pigment epithelium atrophy, then it is not reversible in the dry type. So the message is, if you pick up early, treat early, some of the things are reversible.
All right. So, Mr. Abhishek Jain has a question again, and he has said, "Thank you, doctor. My son is 2 years of age. Since I have macular degeneration, can he also get it? If yes, then what should I do to save him?"
Right. So I think this question is pertinent to another type of macular degeneration, not the AMD, because I think what he has is something which is genetic, some genetic type of macular degeneration. There are various diseases like Stargardt's disease, like cone rod dystrophy, retinitis pigmentosa. There are many conditions which are genetically transmitted. So in that case, there is a risk of transmitting it to your children, but it is not always that it's going to be transmitted. So it all depends on what type of inheritance pattern this particular condition has. So preventing it is very difficult. After the child is born, you cannot prevent genetic disorders anyways. But in the long run, even if the child is developing genetic macular degeneration, then there are a lot of research studies going on all over the world with gene therapies, stem cell therapies, and many, many other things, where it is quite possible that in the distant future, some treatment might come for this type of degeneration. And to start with, it is quite possible that the child may not get it, because as we know, even if we have an autosomal dominant disease, the chances are only that 50% of your children might get it. And if it is a recessive form of condition, less than 25% of the children might get it. So it's quite possible that the child may not have the disease. But to answer the question, if it can be prevented at this stage, the answer is likely not if it's genetic.
All right. Thank you so much. I hope that answered your question. All right. So moving on, I think you mentioned something about the anti VEGF therapy. So the question here is it a painful process, and would it be possible for you to share a little bit on it?
Right. Yeah, this is something which is very important for everyone to know, because this anti-VEGF injections are the primary treatment options for the wet type of age-related macular degeneration all over the world currently, and they are used for millions of patients, and they have been there since the last, I think, more than 15 years, and they are here to stay. So whether they are painful or not, I can assure all the patients that this is a relatively painless procedure where a very small injection and a needle is used to inject a very small amount quantity of the drug, which is less than, it's about 0.05 ml of the drug is injected into the eye, and it is done under topical anesthesia. What we call topical anesthesia, it means we use some anesthetic drops which are instilled into the eye before the procedure, and that anesthetizes the surface of the eye. And these injections are given painlessly, and people take them generally monthly in the initial stages of the treatment, and subsequently as and when required. So there is nothing to fear, which normal common people might have, that taking an injection into the eye is really scary. I think it is maybe 10 times less painful than taking an injection somewhere else in your body. So I think I can assure you that it's really painless.
All right, so we have another live question actually. So someone has asked, does retinal transplant help in macular degeneration or AMD?
Right. So yeah, so that is an interesting question, because obviously uh, we know that in our body we can transplant almost 50% of our organs are transplantable today, including the heart. The kidneys were transplantable since long time. We can transplant livers, lungs, intestines, even skin. I mean, there's nothing left. But when it comes to transplanting the retina, there are a lot of limitations. So till today we haven't come across, we haven't invented something like a retinal transplant that is from one person to another. Now that is something which time will tell, but as of today, we don't have anything like a retinal transplant. But a lot of treatment therapies are tried, or surgeries are being tried, where you take a healthy part of the retina from another location in the same eye and try to transplant it into the central area of the retina. So such therapies are tried. There are therapies where stem cells have been tried for this type of AMD, and various surgical modalities, but the results have not been encouraging in most of the studies. So they are not often done and not commonly done, and we are relying on the injections because they do really good work, and they are relatively non-invasive. So surgical management of AMD is as of now redundant, and maybe in the future, if we get something better, we can possibly think of doing something like a retinal transplant. But unfortunately, today we don't have a retinal transplantation available.
All right, thank you so much. It was very interesting to hear as well. Okay, so now I think this question is very pertinent to the times that we are living in. Is it safe to go through, any form of treatment for AMD while we are still dealing with the COVID-19 pandemic?
Yes, so yeah, this is something which we have been trying to drive into our patients' minds and into their heads, that treatment for AMD, especially the wet form of AMD, is something which has to be done on a emergent basis, because if we don't treat, there is a risk of permanent vision loss or damage to the retina, which is not reversible if you treat at a later stage. So, in that background, I would like to say that we have at Aditya Jodh Eye Hospital, especially, you know, very safe protocols for dealing with patients amidst this COVID crisis. We have all the SOPs in place to make sure that we prevent its transmission and protect our patients as well as us from this pandemic. And we have all the protocols for safety inside the OPDs, inside the operation theaters, and all around the hospital. And everyone in the hospital is sensitized, all the staff is sensitized and taught about how to use the best preferred practice patterns to prevent spreading of the this COVID pandemic. And our patients have faith in us, and that is why they have started coming back to us in large numbers. And it is totally safe now to go to a hospital like us and get themselves treated, because treatment, if you deny treatment to a patient with AMD, it's something like you are robbing them from the rightful vision that they should be having. So in that, I would like to end with by saying that you should not wait, and you please come to the hospital and get yourself checked in case of any doubt, and you are assured of getting COVID free treatment, especially at Aditya.
All right. Thank you so much for that. What are some of the questions, or rather the important questions, that a patient should ask their doctor or eye specialist regarding AMD?
Right. So the the patients should ask the questions which are pertinent to their vision. They should be aware that what is it that is a sign of early disease, and what is something which is a sign of recurrent disease, and some things which should prompt them to immediately contact their retina specialist or their eye doctors. And other questions should be about how to monitor themselves at home, and what are the treatment options available, understanding the treatment options, just like I just explained. And unless you believe that these are the treatments which are going to help me, you may not be able to have confidence in the doctor as well as the treatment. So you need to know what you can do at home. So as I described the Amsler grid test, there is a simple test, a chart which you can keep at home and keep monitoring your eyes on a regular basis. We recommend at least once in a week or more frequently depending on your condition. And in case you see any abnormality in this test at home, you should immediately report to your doctor. When you're visiting the doctor, you should describe your symptoms appropriately. You should plan your visit, and in the COVID times, as you know, you should take appropriate precautions when you are going to the hospital, so that you are safe and everybody else around you are also safe. Please follow up with the doctor when the doctor has asked you to come back, because if you miss your visits, there is a high chance that you may not understand what is going wrong inside the eye. So how frequently you should visit, that is another important question you should ask your doctor when you're leaving. So that is what I can think of at large, but in case there are any specific questions, I can answer them.
All right. So I have a few more questions that have come from the live audience. One of them is, how closely related is a dental problem with AMD2? Do you do optical or the OCT test for it as well? I repeat, how closely related is a dental problem with AMD, and do you do OCT for that?
Right. So to answer the first question, AMD is not related to any dental problem as far as I can remember. So AMD and dental conditions are independent of each other. The second question, yes, we do OCT or optical coherence tomography for AMD, and we do it for diagnosis, then we do it for monitoring the treatment, and we do it for following up even after treatment. So a patient with AMD is most likely to have to do these OCT scans every visit. So just to give a brief about what this OCT stands for, it is nothing but a scan of the central 5 or 6 millimeters of the retina, or that is the macula, and it looks something like a CT scan, but it is at a microscopic level. So we have very advanced machines now, and we can actually, have a resolution as small as about 4 to 5 microns. And there are some advanced machines where we have what we call OCT angiography, where we can even see the vasculature or the blood vessels in the central retina without doing an angiogram. So OCT is the primary investigation now in AMD. So that is something which most patients with AMD will be very familiar with. The good part is it is non-invasive and it takes a few minutes to do it.
All right, thank you so much. And the same person has asked another question. Can we restore voltage to a retina through electrons? Okay. All right. So, okay, I don't think that question is entirely clear. So I'll move on to the next question. How should our daily diet be in order to slow down the progression of AMD? And can you please also suggest how to get low vision aids?
Right. So as far as the diet is concerned, the diet for AMD is nothing special or different. It is just a balanced diet that we would have. There is nothing that you can increase or decrease in your diet, which is very specific for preventing AMD. So a nutritious diet which has antioxidants and all the essential vitamins, which are present in our healthy balanced diet, are more than enough. But yeah, when you have been diagnosed with AMD, especially the dry type of AMD, in that scenario, you may need a supplementation in the form of some capsules or tablets, which will enhance the or rather it will rather decrease the progression speed at which the disease progresses. So those are to be given above your normal diet. So there is nothing very specific like an AMD diet or something. Any balanced diet in any part of the world is good enough. So just do that along with other healthy lifestyles like good exercise, avoiding obesity, smoking, treating your hypertension, and other conditions. So these are the things which you need to follow, basically. And the second question about low vision aids, how to get low vision aids? I think you need to visit your nearest ophthalmologist or your retina specialist, especially, and they will guide you where you can find good low vision aids. Before you get the low vision aids, you need to get tested and you need to do a trial with a low vision aid and see if it suits you. Only if it suits you, then you can ask for it or order it. Because most of these equipment are expensive, and you may not be very happy if you just take something and then try it out. So it's always good to visit your retina specialist, do a low vision trial, and then decide which one to get, and they will guide you from where to get it.
All right. So on that note, I would like to add to Dr. Jaydeep that Aditya Jyot Eye Hospital has a low vision aid department. So patients can visit there for a trial for the low vision aids that they require.
Absolutely, absolutely.
All right. So I have two more questions, and we can wrap it up. So this is a question which says, does having watery eyes mean I'm about to have wet macular degeneration, and does having dry eyes mean I'm about to have dry macular degeneration? Is there something like that?
Right. So, well, I don't think so. So, uh, there is nothing like that, because they are totally different pathologies. And wet type of AMD for lay people has been described as wet type of AMD because there is some leakage and some bleeding under the retina in that type of degeneration. So it has been termed as wet. And in dry type of AMD, there is no leakage. So that is why it is called as dry type of AMD. So it has absolutely no correlation with watering or dry eyes.
All right. So, this was a question that I think you answered earlier in your presentation, that, there's a particular gender that's most susceptible to having AMD. But is there a specific reason for that, or is it just, could you elaborate a little bit on that?
Right. So we haven't found any specific relation with any condition that predisposes women to get this age-related macular degeneration more. But that also, it is more in the elderly age group, like say about the age of 75. The risk of getting AMD is twice as more in women than in men. Now, that is just something which we find in our prevalence studies, but there is no definite hypothesis why it happens. So it's difficult to explain by any theory, but it is just a finding which we have.
Right.
So it is something where we need to just educate people that this is something which is possible. So women may need to have a retina checkup definitely after the age of 50 regularly to make sure that they are not developing it.
All right. Okay. Thank you so much, Dr. Jaydeep. We will have to wrap up the session, even though we would have loved to continue. Thank you so much. It was not just a pleasure to have you speak to us and explain every single question with so much patience and a lot of, rather meticulously, but also helping the audience become a lot more aware and comfortable with the concept of age-related macular degeneration. And hopefully it has eliminated a lot of their fears. So to
Yeah.
those watching us, if you have any further questions or you would like to get yourself or a loved one assessed by a specialist, kindly connect with us via phone or our social media platforms such as Instagram or Facebook, or you can log on to our website, which is www.adityajyotihospital.org. I repeat, www.adityajyotihospital.org. Our team shall assist you with the needful. If you think this session has helped you, please share this ahead with someone who you feel may benefit, and stay tuned for our next session next month, which will have another specialist. Until then, thank you so much for joining us and spending your time and asking us wonderful questions. Stay home, stay safe, stay happy, and happy Diwali in advance to